Tell him your name. You didn't tell him your name. What's your name? What's your name? Put your hands down. What's your name? Can you please tell me your name? If you're home alone and need to call for help, you know you're on TV? Tell everybody your name. Come here. You're on TV. Do you go to school? No? Do you? Where do you go to school? Where do you go to school? What grade are you in? Can you do jumping jacks? Now make fun of the cameraman. Give him a funny face.
Okay, we're done. We got it.
Afam was formed in 2004, and it was a result of a collaboration between a number of organizations, autism support centers, that had been meeting for a number of years under the guise of that time the Department of Mental Retardation. And the group decided as a whole that it would band together and begin to advocate on behalf of the families that they represented.
We realized how important it was to unite with other local autism organizations and make a concerted effort to influence local legislation and healthcare policy that would benefit children affected by autism and their families.
The prevalence of autism will drive the momentum. We need to advocate on behalf of funding for children and adult services and to fund programs like early intervention, special education, and then move into the adult arena for the tsunami of kids that are and are going to turn 22 and enter the adult system. The children's system is an entitlement by law. The adult system is at the mercy of funding every year. And that's what makes AFAM's work so critical.
By having proper education, we can educate not only the kids that are on the spectrum, but to educate other kids to the importance of differences in people's learning styles and the way they carry themselves.
I think having good connections with the legislature, with the governor's office, and local government officials as well is extremely important. And I think particularly with autism that it's essential that we keep up the effort to make sure that public officials are well informed about the challenges that individuals with autism and their families face. The education effort is central to funding as well.
One of the things that AFAM does so well is to advocate for the expansion of these services and to advocate for increased insurance coverage for autism. The idea of treating autism as a medical condition and not as a mental health condition, which it traditionally has been.
I'm chair of the insurance committee for AFAM, which has been working on expanding insurance coverage for people with autism, and our primary focus over the last 2 years has been on passing legislation that would require health insurance to cover medically necessary treatment for individuals with autism.
I think that as we look big picture and further down the road, we can get to kids, treat them better, have better outcomes, and it costs a whole lot less for our state than for our parents who are currently taking out the healthcare.
When the governor signed Eureka, I was so thrilled that the bill was law and that we had really proven the power of what a good organized grassroots work can do, and that we were able to celebrate it with so many families at Fenway Park, and that we had passed the most comprehensive insurance coverage bill in the nation.
We as autistics have to say we deserve to be given equal access to education, to jobs, to health care that we need, to the therapies that will help us.
I'm a parent of a son with autism who's now 23, who's transitioned from special education services and is now a young adult. I serve as chair of the Adult Service Committee of Afam. The committee was formed in 2008 to focus on issues affecting adults with autism spectrum disorders. And that committee is comprised of professionals who work with children and adults with autism and parents who have family members with autism, some of whom are in their 40s and 50s, and some with children who are approaching the transitional ages, 18, 22. So we're trying to put our collective experience together, reach out to our community, and reach out to the people within the state, both in the legislature and on the executive side, who bring services to adults with autism.
Get involved. You are your child's advocate. You are their voice. Make those phone calls to the State House. Call your legislators. Talk to your relatives, your friends, because the more people that call, the greater the impact those calls have. And Eureka was a perfect example of that. We passed a bill. We easily flooded the State House with phone calls when we send an alert out. And that's what happens when people get engaged.
We hope that families with young adults will become involved in AFAM's advocacy efforts. They can start by reading our newsletter, our website, responding to our email alerts, and getting to know their legislators, their state representative and their state senator.
We have made a real presence at the State House. I think most legislators have probably heard of Afam by now, but I do think we still have a lot of work to do, and we hope that each year we can make a difference.
Some of the most courageous people that I have met in my life are those impacted by an autism spectrum disorder. Not just the individuals that have the disorder, but the families that have been affected by autism. And they are just, they are just my heroes because of the time, the effort, the advocacy, and that's just one part of it. That doesn't even address what they have to do at home to care for their children, and not only their children with autism, but the rest of their family that this disorder has impacted.